Hello everyone, I'm really sorry I couldn't be there today, but I just wanted to record a little video talking about some of my experiences and around personalised care and support planning and personal health budgets. So, as many of you will know, I'm Lucy, I'm 25, almost 26. I have a personal health budget. I've had another personal health budget in the past that worked very well for us. I have 24/7 care. I have a brilliant personalised care and support plan on which all my care is built around. And I just wanted to speak about how we can use personalised care to make a difference. So the way I see it is personalised care and support plans should be done much earlier in the course of illness. So early on, they have a personalised care and support planning meeting, their needs are mapped out, their care requirements are mapped out, their family situations mapped out, and actually we can then look holistically at the patient and then look at what's out there, what services are out there, and think what can meet that person's needs. So in the early days, it might not be a personal health budget. It might be social prescribing, it might be other support, it might be, just a bit of patient activation. There's so many different things you can do with that personalised care and support plan meeting, and also the reviews that are supposed to be inbuilt with the personalised care and support plan. But the other thing for me is for people that are end of life, so people like me with life-limiting conditions, if we have an early personalised care and support plan, in which our needs are mapped and the big picture is mapped into a care plan, we might be able to look at their needs over time and start to map deterioration a lot earlier. I know with myself, I often map myself against my own personalised care and support plan, so I tend to update mine a couple of times a year, with the team or on my own, and then we send it around the team. And that forms a really useful benchmark to look back on. So where was I 3 months ago? What were my needs then? What were the updates around my health? How was I feeling? What was I struggling with? Have I got better in any aspects? Have I got worse in any aspects? It's a really great way to think about the person holistically and what's happening in their life. And it's even down to things like when you set goals. If I've been meeting my goals, every time I set a goal I meet it for months, and then suddenly I'm not quite hitting those same milestones and those same goals, that would also be a red flag to think, actually, let's do a reassessment, let's look at the personalised care and support plan. Are they deteriorating? If so, in what way? Get an MDT involved. And if they are life limited and they start to deteriorate, you could think about a continuing healthcare assessment, you could think about personal health budgets. There's so many different things you can do with early personalised care and support plan, and the limits to what it can achieve are endless. But it enables us to be a little bit proactive. Our system is notoriously, it waits until a crisis, it's reactive, it waits till everything goes wrong and then goes, oh, what do we do now? And then starts backpedalling. But actually I think personalised care and support planning and personalised care generally can help us to be more proactive, look at needs earlier on, start to map out the services that are available in that area. Even if they're not going to access those services now, knowing that they are there and they are available and that they meet their needs is really important. It just enables you to kind of keep an eye, move forward with things, reassess goals, reassess health, and start to plan for future care. If you have a degenerative condition, you're naturally going to need more care over time. But if you've mapped out those services ahead of time, when it actually comes to needing those services, it's a lot easier to set that process in motion and get those things put in place. And then for people like me who have personal health budgets or need personal health budgets, they offer a really great way of meeting needs holistically and creatively. Now, for people like me who are living life to the fullest and wanting to achieve all their goals and wanting to do all these amazing things and live their lives in their own choice and autonomy and having flexibility to live their life as they choose. But also, when you have a life-limiting condition, perhaps when you're deteriorating, when you're reaching end of life, having that care staff around you already in place who can meet your needs now, but also are future-proofing your care. So as you reach end of life, even if that package might need to be increased or new services added, actually that package is there and it can meet people's needs, and it can ensure to the best of our ability that people's end of life care wishes, so the advanced care plan, will be followed as best as possible. It gives more choice and control. And having the care at home now and having it around me, for example, means that my staff know me. They've looked after me for a long time. They know the person they're caring for, they know my needs, they know what's normal for me, perhaps what's not normal. They can monitor things in a minute way, in minute detail, and in a very detailed way. So as I deteriorate, we can upskill my nurses, we can upskill my carers, but they're there to provide my care 24/7, 24 hours a day, 7 days a week. And they can meet my needs as I reach end of life. The sad fact is, it's probably an infection causing sepsis that's going to end my life. It will probably be in ITU, ventilated, sedated, multiple organ failure. But actually, if that's not the case, then I could be kept at home for as long as possible or be rapidly discharged from hospital to my home care team with the support of the hospice and other services. So there is so much we can do with personalised care, but especially personalised care and support planning as a way of being proactive and assessing needs early, mapping out the services available, mapping out the person and what they want to achieve with their life and what living looks like to them. That includes advanced care planning if they have a life-limiting illness. It shouldn't be separate. A personalised care and support plan should include those advanced care plan documents. Care escalation or treatment escalation plans, it should all be in there. But also for personal health budgets, it's important to remember that personal health budgets are, thought of as a way to meet needs as people live their lives. But for some of us, personal health budgets really can make our end of life the best possible for us. And I think if we can really get those budgets in early and assess people's needs and build a package that meets their needs throughout the course of their illness. It might have to be adjusted or changed or things added or removed, but the package is there, it's meeting their needs, it's giving them choice and control and flexibility, enabling them to live well right up to the end. So personal health budget for me have been amazing. They've given me back autonomy over my life, choice and control and flexibility. They let me live the life I want to lead, to go and do my speeches, to go to events, to walk Molly dog, my assistant's dog, who many of you will know. Obviously she's more famous than me, aren't you, Molly dog? And to live the life that I want to live whilst I still can. And the way I live my life changes as I deteriorate, but the fact is the personal health budget means as I deteriorate, I still have that choice and control. I can reevaluate my life and reevaluate my goals, but still keep pushing on into the future. But when I reach end of life, when I reach the very last stages of my illness, I have the team around me to meet my needs at end of life with the support of the hospice, the palliative care team, the district nurses, my GP, my NHS consultants. The whole team can come around me and be built around me and to support my home care team to look after me, provided by the personal health budget. So I hope this has been very useful, and I really hope I can join you all in future for future meetings, but just remember that this is about people. And when I say people, this is about me, people like me that are patients, this is about carers, this is also about staff. This is about all of us as people coming together and making the system work for everyone. So thank you for all you do. I know not all your patients will be able to say thank you, so I'm saying thank you on their behalf, and I hope to see you all in the future. Thank you.